A little bit of background. I went to Southern Utah University for undergrad. I was an athletic trainer there. I played baseball there. And if any of you know baseball players, we try and avoid running, 90 feet is about as far as we want to go. So for me, running always was equal to punishment, or you're dogging it, or you're in trouble. And I didn't really jump into running at that point. And then I went to the University of Utah, the physical therapy school. Had a friend said, "Hey, do you want to run the marathon?" I'd never even thought about that. And I said, well, sure. And so then I started doing some research. I found Jeff Galloway's book called Running, I think it was called. Anyway, have anyone read or heard of Jeff Galloway? Yeah, so he does kind of the run-walk method. And because I'd never done any training, running to me was a punishment. So I started that. This was in 2007. And I followed his plan and finished the marathon. Felt pretty good and got the runner's high, and I enjoyed running, and I never thought that I would. I've done a few halves since, and it got to the point where I'd like to run. I've done a triathlon. I mountain bike a ton right now. I don't run a lot, but that's kind of where my passion for running came from. So today we're going to talk a lot about injuries and things that we can do to prevent them. Just some common things that happen within runners. Just hit any button here. Okay. A couple things. Running is a great sport, but it does put a lot of demands on our body. 60 to 70% of runners get injured yearly. I think anybody who's been running for a fair amount of time can see that. And a lot of the research shows that's usually in the first couple of years of running. Most of these injuries happen for a variety of reasons. So 2.5 times your body weight per foot strike. Each foot hits the ground 800 times per mile. So if you weigh 120 pounds, that's 240,000 pounds of weight per foot per mile. 63 million pounds per foot in 26.2 miles. I mean, that sounds doom and gloom, and like, why would anyone ever run by reading that? But that just gives you an idea of the kind of forces that are involved in every single step. So it's important that you're biomechanically set up to absorb that. Couple things. This is on runningusa.org. The participation, I think anyone can agree that running has become more popular, and this statistic shows that. So in 1976, 25,000 people were doing marathons. 293,000 in 2011. 518,000 people completed a marathon in that year. So those are pretty big jumps. 60% of people that run are 25 to 45. Based on the crowd here, that's pretty accurate. In 1990, 75 of those were male, 25 female. 2012 kind of switched a little bit. 46% were male, 54 female. So on that, can determine injury based on genetic predisposition and alignment and stuff. So we'll get into a little bit of that. This was kind of interesting. It looks at the finish time. So in 80, the average marathon ran by a man was 3 hours and 32 minutes. Then in 2012, that jumped up to 4 hours and 17 minutes. So you go from an 8-minute mile to a 9:50-minute mile. In women, 4 hours, so 03, to 4:42, so a 9:30-minute mile to a 10:48 mile. I mean, what does that mean? To me, it means that there's a lot more people obviously running marathons. And the type of people that are running marathons are more like me, average Joe, not an elite runner, haven't broke records, but you want to get out and run and compete. So in my profession, you're probably going to see more injuries, just because of that fact. When you don't understand something, you're learning, especially those first couple of years, there's going to be a learning curve to how to run, when to run, and all the things to do. All right, so this study by McKean in 2006, they surveyed 2,800 runners. I didn't get numbers here on the ages, but it showed younger runners experience more knee and shin problems. Older runners, more calf, Achilles, and hamstring. Kind of an interesting thing. Like I said, I don't have the exact ages of younger and older. But what I get from that is maybe more unstable or weakness in the younger people, and in the older runners, more rigid, tendon-like stress injuries. All right, and this study in 2002 was out of the Army, and they looked at 2002 patients in a 2-year period that came in with any type of a running injury. We're not going to get way into the research and the studies, but I think this was a very interesting one. They looked at common injuries and anatomical trends. Some of you may not be able to see that, but out of 2002 people, 331 of them had what's called patellofemoral pain syndrome. So basically any pain that's originating in and around the knee and the kneecap. Okay, and that's by far the most common complaint, common injury, followed by the IT band, which I'm sure everyone's heard of that, and then plantar fasciitis, and a list of other injuries. But obviously the bulk of the problem, as you can see, is right up through this region. In this study, they did find more meniscal injuries than they had before in any other study, and 70 of those were men. And they, in a slide here in a minute, it shows the demographic of the age of the patients and kind of fits. So just percentage, 42.1% of the injuries were at the knee. And that would be including IT band, attaches down to the outside of your knee. So kind of some interesting things, and that's when we get into kind of treatment, that's the top 3 is what I'll focus on. Obviously there's other injuries that can occur, but for the most part that's the most common that we see. So here, average age, of the knee group, 32. Average overall was 36 of all the patients. That's kind of fits with what we talked about earlier. 25 to 45 is most runners. Meniscal injuries, a little bit older crowd. Plantar fasciitis, a little bit older. And it obviously with meniscus, you're probably going to have some arthritis issues and things like that. So, all right, so I went to a course in May, and it was a guy at Tosh. His name's Jona. He's a physical therapist, and he sees primarily runners. And in that hospital, in that area, they get a large volume. I think here at Dixie, we don't see quite the volume that they do. I mean, his bulk load, or his caseload, is probably 90% runners, competitive runners, college athletes. And he combs the research regularly. And some of the things that he found is overall injuries are more common in new runners, so within the first 2 years. And I think some of that's learning curve, training errors. I know for me, when I started, I was having a lot of different things. I just threw on some shoes that were sitting in my closet and ran about a month on those. And, as you all know, it wasn't the best shoe. And I got a better shoe and had some better results. Tendon injuries, Achilles, adductors, more common in elite older runners, more experienced runners. I think it goes back to that strain. They have the strength, but the tension isn't quite there, not as elastic as maybe a younger runner would be. Lowering mileage below 32 kilometers, which I calculated is like 19 miles, shows significant effect on returning from injury. And other studies have talked about 30 miles a week. So I think that's a big part of preventing injury and returning from injury, is understanding the impact of how many miles you run and how many days that you run. And we'll get into this a little bit, but I've treated some people that they're working on training for a marathon, and they have their schedule. Their little runs in the week and then their long runs, and maybe they miss their long run on Saturday, and then they jump into the next week and do their long run, then do their little runs, and then do another long run. I think there's a problem with that. If you miss your long run, fine. Jump back into your next week and do your long run again on that weekend. You got to look at your cumulative miles, and kind of going back to what that first slide of the force and the impact that comes through the foot on every single step. And so your mileage increase has a big impact on that. And then kind of the same thing, recommend 10% mileage change per week. So it's a gradual process. You know, you don't go from 0 to 60 without problems. And so in running, it's the same way. You got to incrementally increase that distance change. Do you guys have any thoughts or questions? You know, like Allison said, there'll be time at the end, but if you haven't, feel free at any moment to interrupt. Couple things that are factors in running injuries, like we talked about, training errors, mileage increases too soon, overuse, improper fueling. You know, that's a whole nother topic, I think. And do you have a nutrition aspect in this?
Well, we did.
Oh,
so
you did.
That's a constant one. And we have a card for if you have questions about nutrition. She is a sports nutritionist. She's awesome.
So that's a huge part too. And I learned a ton reading Jeff Galloway's book about what to eat, when to eat it. You know, and one thing that he stressed in there is don't try things on race day. You know, you try things leading up to that, you find what works for you, and then you stick with that. You know, you don't wear a new pair of shoes or a new pair of tights or socks. You know, it's almost like you get superstitious and you have to use the same things. That's how I got anyway. Maybe some baseball player going out. Training surfaces, that's a big part too. You got to be aware of maybe the incline or the pitch. You know, if you're running on a road, obviously roads are going to be high in the center, low on the edges. Think about that. You know, that can have a huge impact if you're running, you know, down a road with a pitch for, you know, 15, 16 miles. You think about the forces that are applied down through your lateral leg and knee and IT band. And, you know, those are things to consider, you know. I think the more you educate yourself on what you're doing out there, the better off you're going to be. Poor equipment, that's probably referring mainly to shoes. Previous injury, you know, if you've had injuries in the past and maybe haven't dealt with them appropriately and then you jump out there and run, it's going to have an impact on your performance. Genetic predisposition, poor foot mechanics, you know, if you have, you know, a low arch or an excessively high arch, or you pronate or you supinate, you know, all these things are critical in being able to run and run pain-free. And I know you guys probably know this, but the running store, they're great about fitting your shoe. What's the guy's name over there?
Steve Hooper.
Steve, yeah, he's a stud. I took my wife over there to get some shoes, and I was very impressed with him. Real knowledgeable. Gender, that's another factor, you know, and I think that comes into play really with patellofemoral pain. It's very common in women. Has a lot to do just with the angle of our legs. You know, a woman's going to have from hips to knees to foot, they're going to have an angle that comes more this way. So you're more knock-kneed, and that's just genetic or specific to gender. And so that has an impact on the way that when you plant and land, the forces that go through your knee.
Can I ask a question?
Yeah.
I had someone tell me that because I walk with my feet out from a dance history, that is injuring me, and that when I run, that foot strike with toes pointed out is improper, but it's supposed to be straight. Is that correct?
Well, I can see where they would say that, you know, because if you do land here, especially if you have a lot of pronation in your foot, that's going to put a lot of tension through that medial knee. Do you have knee pain?
I had it before. I don't right now.
Okay. You know, I think everybody runs differently. I think if you show up to a marathon and you watch the runners, everybody runs differently. So for there to be one form or one way to run, I think it's false. I mean, but obviously if you're landing a lot like this and you're having pain, that's a problem. But if you're able to run pain-free in that pattern and you feel supported and stable, then that's okay. You know, one certain way doesn't fit for everybody. And that's something that Joe Nuttall stressed a lot. Because I was kind of the impression that there's ways to run, and there's good form, but some people, everyone's built differently. And so you can't tweak everything. And he said sometimes he'll look at people running and he's just like, that's gotta hurt. So they don't say it hurts, it's okay, they don't have pain. So leave it alone. You know, who knows if you try to correct and bring your toe in, that could create problems too. So, and if you dance for a lot of years, you're going to have some adaptation in your tissue to allow for that motion. And so you try and correct that with running, you may have a problem. So I think it's a case-by-case scenario. So good question though. This is a quote from the Running Association: all overuse injuries are training errors on some level. Food for thought. So let's talk about what happens when you're injured. So physiologically, injury occurs when forces placed on tissue exceeds its ability to withstand them. Can either be one event or a cumulative event. You know, like the tendonitis is more cumulative. Damage occurs on cellular level and then triggers the inflammatory cascade. Body heals itself through an inflammation process and creation of scar tissue, which is a good thing. You know, if you have a cut, you're injured, inflammatory process kicks in, scars that, heals it back together. That's a good process. It's when it continues that we got problems. So there's 3 phases. Acute phase, within the first 3 to 5 days. Ice, you know, things to reduce swelling in that phase are appropriate. Proliferative phase, that's day 5 to 21. And then maturation, that's day 21 to months. And the problem comes when that process doesn't ever have an end point. It's continuing, it starts, and then it just perpetuates itself. And that's what an overuse injury does. Like your knee. You have an initial injury, it creeps up, and it just continues to happen, and that inflammation builds up, and then you get scarring within there. And we'll get into some of the treatment, but this whole process here is the reason why, I don't know if anyone's heard of Grafton or A-stem. Anyone heard of it? Okay. So this process here is the whole reason it was kind of developed. You know, you have the scarring that builds up within your fascia, which is a covering over your muscle that interconnects some of the muscles and makes your body move in synergistic patterns so they can work together. And whenever there's a problem within that process, it's usually because of scarring and inflammation. So these tools, they look barbaric and torturous, but I wanted to show you guys. There's 6 different tools. They're stainless steel, soft edges, nothing sharp. We're not cutting anybody. But what we do with these is you actually get into that tissue and help remodel it. So this process that happens, you know, you get this inflammation cascade that just keeps continuing, and you get built up scar tissue. So you have this lining over the muscle that's not appropriate. So it's not smooth. Yeah?
Or the tendon?
Or the tendon.
Okay.
Yeah, same. Yep, all through that process. And as we get with this tool, you can work that tissue to where it's appropriately gliding and moving like it should. So there's a variety of ones. Obviously, ones that are more broad-based, like this one and this guy. There's some weight to it, so it can do some good work. And then some of these are more pinpoint, and you know, we kind of use them as needed. And I think we've had some pretty good success with it. It's a tool in a tool bag. You know, it's not going to fix everything, but it can be an aspect of treatment that's beneficial. And it all kind of originates off of this inflammation cascade. So just a little anatomy. So this is the outside of the leg. You got your glute, and then your IT band coming all the way through here. And within that IT band, you have this TFL, tensor fasciae lata, which is a muscle. And you can see the length of that IT band. You know, a lot of times people will say, my IT bands are tight, I need to stretch them. You know, it's a hard thing to stretch, connective tissue that runs from your hip to your knee. I don't know if anyone's been effective in stretching an IT band. You know, there's stretches out there, and I think you can find some benefit to it. But I think the most beneficial thing you can do is Graston-like stuff, trying to scrape through that tissue, work some of that inflammation out, and then foam rolling, those type of things are effective for helping not necessarily lengthen the IT band, but allow it to move like it should. It's not restricted. Because the fascia is going to be all over this. So it's hard to really itemize out within the fascia if you have some scarring or buildup, you know, it's going to inhibit all that, those muscles and working together. That's the main focus of it. A lot of times, I'm sure you guys have had friends or you yourselves have had some of this lateral knee pain right down through here. That's right where the IT band inserts down below. And it actually crosses over the knee joint. So it's a two joint muscle. It's not just controlling the hip, but it also crosses the knee. And then this is just a little bit closer look from here. So the IT band coming down here, lower here, then you have your hamstrings, all kind of tying in right there. So it's, you know, within patellofemoral pain, it's never just one thing. You know, because of fascial connections, there's a lot of tissue that can be affected right there. So, all right. So what do we do about it? Best achieved when balance between deferring to your physiological limitations and gradually attempting to change them. So you understand what you're working with, and then trying to slowly adapt that process. That's why it's got to be an incremental, slow change rather than 0 to 60 to avoid problems. So a couple things, I think, like I mentioned earlier, education's number one. The more you know, the better off you're going to be. Educate yourself. And nowadays with the internet and social media, there's so many ways. You can almost get over-educated. So I think find what works with you as far as a running method, and go with that. You know, come to things like this. Just educate yourself on the appropriate ways to run, because it'll save you in the long run. Correct footwear. You know, that's usually a big topic within marathon people. Is, okay, what shoes do I wear? You know, do I not wear shoes? Do I wear pillows under my feet, like these new shoes they have out? So it's, I don't know, Joe Nuttall, the guy up there, he wouldn't even talk about shoes. He didn't even want to get into that. I think, my personal opinion is, you find a neutral, good shoe. You know, they went from barefoot running was the fad. Had a lot of problems with that. Some people didn't, had success. When I was running my marathon, I ran by a guy, this was in Salt Lake, all around, you know, paved roads, there's rocks, there's glass, all this stuff. And like mile 18, I passed this guy and he doesn't have his shoes on. I'm like, where are your shoes? It's like, not wearing them. All right, whatever works for you. So they went from that barefoot running, and then now you can go get shoes that the Hokas that are like, you know, this thick. So to me, that just says that there's such a variable opinion on shoe wear, and a lot of it's popularity. You know, the barefoot running kind of caught on, so everybody's like, well, this must be the way to do it. They did it in Africa when they're running from lions. It must be the way to run. And so then people have problems with that, and now they're going to the other end of the spectrum with these huge built-up shoe. So I think find what works for you, get your foot evaluated by a professional, and then find the shoe that fits. You know, I don't think it needs to be a minimal shoe. Some people like those. And I don't think it needs to be the big fat one, but some people like those. Find what works for you and stick with it. Training programs, cross-training, I think that's huge. You know, you don't want to just be hitting the same key on the keyboard. You want to, you know, vary your activity, whatever that might be. And we'll talk about a couple of different options. Stretching, obviously, you want to do some, and I think not just, you know, standing out there trying to touch your toes for 5 minutes and then go run. You know, I think dynamic stretching. You know, you do some things to get your blood flowing, get your hips opened up. You know, variety of movement, not just static stretching, but dynamic. You know, high knees, butt kickers. You know, a bunch of different things to really get yourself moving before you take off and run. That's a big part of it. Medication if needed, nutrition like we talked about, and then if you're really having problems, come see a professional. We got a lot of really good therapists within here that have been treating runners and athletes for a long time. Dave Esplin, John Sparks, Mark's been here a long time. You know, a great clinic. So if you do have problems, you're running into some significant pain you can't work through on your own, come see us. All right, So a couple things that you can do easily on your own. So a functional squat. As you'll see, I could probably use some work. But what a functional squat is you try and get down here just like this. Does everyone want to try this? Yeah? No? Try it. Everyone stand up. So what you're trying to do is get your feet about a little wider than your shoulders, okay? And then you want to drop down, keep your heels on the ground, and try and get into a squat. Just like, have you seen your kids? Like, watch your kids. They'll go, does everyone have a problem? Is it kind of hard? Yeah. Hard through your hips, through your ankles. You know, so if you're having some issues with that, maybe even take a picture, film it, and then go back and look at it. See where your problems are. You know, is it in your ankle? Is it in your knee? Is it in your hips? But watch your kids. Like my kid was sitting on the counter, and he was full on, down like this. I mean, I have to put my arms out or else I'll fall over. But he's just sitting there. Feet are flat, full range of motion, his knee, hips, and ankles. So they can do it then. What happens to us now, you know? We get bogged down with maybe tension because of over strengthening some muscles, neglecting others, you know, things like that. But that's a really good way just to see where you're at. You can get a good idea of where your problems are with that functional squat, okay? Jack Daniels did a lot of research, not the drink, the guy, but he talked about some areas that have to be highly flexible to be a good runner, okay? First one was your calves, okay? So you need at least 10 degrees of active dorsiflexion. So that's this motion. So toes coming up, okay? So a good way to test that, so KTW, that's knees to wall. So what you do, here, I don't know if you guys see this, but you get your foot here, and then you get to the point to where your heel stays on the ground, and you get your knee to the wall, and then you measure that distance. So normal, you should have 10 to 12 for a female, 12 to 14 for a male.
Inches from the back of your heel?
Centimeters from the wall.
Centimeters from
So
the wall.
so wall to your toe.
To your toe.
To your toe, yeah. And I can, if you guys want to leave your email, I can get, Allison has this PowerPoint, so we could, I wouldn't have a problem sending it out to you. You can take pictures with your phone too.
I missed it now. What was it, 10 to 12 from where?
10 to 12, so you go, so let's say the wall is right here, this thing. So from here to the tip of my toe. And you get to the point to where as you bend your knee and your ankle, your heel stays down and your knee touches the wall. So if you get real close, obviously your knee's going to hit pretty easy. Slide back, keep going until your heel comes up. And then you'll see where your ankle range of motion is.
Are you going to give us a list of exercises or stretches that we can do to achieve
that?
To achieve some of these?
Not specifically, but
give you a call.
Yeah. Exactly. Okay, the next one is quads. So lying prone, which is on your stomach, you should be able to easily get your heel to your butt. So if I'm laying on my stomach, that hurts a little. You get your heel to your butt. Okay, so that with your hips straight. Yeah. If your hips coming up like this, then obviously you got some problems.
And your knees still on the floor.
And your knees still down. Yeah. And that looks at a couple things, because you have a muscle called the rectus femoris that attaches to your hip, goes all the way down, ties into the quad tendon, and then across the patella and down to the tibial tuberosity. So you're crossing your hip and your knee. So when you lay on your stomach, you're stretching your hip flexor and your quad. So that's a good indicator of both of those lengths. And that can be done with somebody's help. You don't have to actively lift it. You can hook a rope to your foot and try and pull it that way. You know, it shouldn't be active. It's harder if you're laying there to try and pull that all the way, because you're going to run into just your hamstring won't pull it that whole way. Have your wife or husband just force it down. And it shouldn't be tight or hurt. If it does, then you want to do some of that stretching. And that, because on your stomach, you're going to stretch your hip flexor. Throw a rope or a belt or something onto your foot, and then pull that leg up, and then hold. You can push into the belt and then hold some more, just doing some contract, relax stuff. And that's definitely been linked to patellofemoral pain, this tightness in the quad. You know, just because of the tension, it's going to not allow for the proper motion. Hip flexors, so if you're laying on your stomach again, you should be able to lift up this way, okay? So your knee doesn't bend as much, you're here, and then you're coming up like this. You should be able to take that off easily, okay? I know men particularly are really tight in their hip flexors, so if you lay them on their stomach, and then you actually hold right here and lift up, it's like nothing there. So you should have some play within your hips. My hips are tight. That's an area that I've been trying to work on. Does that make sense to everybody? So it's linked with hamstring strains and low back pain. Obviously low back pain, if you're really tight in those hip flexors, that's going to affect what happens back here. And I think, that's probably predominantly in the male population. Tight hips creates back pain. So, and then hip IR, which is internal rotation. So that is this motion right here. It should be the same both sides and springy. So if you lay down on your back and somebody bent your knee up like this and then moved it like that, you should be the same on each side as you move it in. Should be symmetrical, springy, and if it's different, you'll feel it and you'll know it, okay? And then your big toe, this is a big one. This is something that I think is overlooked a lot. So your big toe should be parallel to your shin. So you guys have flip-flops on. So you should be able to get your big toe and pull it back to where it runs parallel with your shin. Can you do that? Let me here, slide this off.
And your other toe should stay on the ground?
Yeah, put your foot down, and that should come up. So if your foot's like this, here, do you want to come up here for a minute? Is that all right?
Maybe up to the side, Jona.
Yeah,
like,
it's right over here. So you're just standing straight up like this. This big toe should be able to come. She's not bad, but she's able to come maybe even a little bit more, almost a full 90 degree. So it's parallel with your shin. So and then if it's not, what that does is as you pull that toe back, feel your arch as you do that. That is directly affected by that plantar fascia if you're tight within that big toe and you don't have the range of motion that you need. All that force that should come in your toe as you come off and push is then going to be translated to your plantar fascia. And then you can get plantar fasciitis, and a lot of the treatment would be helped by improving your big toe range of motion. Does that make sense, everybody?
We just pull on our big toe.
What's that?
That's what we do. Sit up.
Yeah.
Yeah. Okay.
Yeah. Roll out your plantar fascia, loosen that up, pull the toe up. You can do, some of these stretches like this, kind of bounce it. You can grab your toe and move it up and down. Do you mind if I grab your toe? Just kind of like this, just playing it back and forth. Just trying to stretch it out. It's not rocket science. Just trying to improve the motion within that toe should have an impact on. Especially if you're having plantar fascia and symptoms in your foot, try that. That could make a big difference. Seems simple, but could definitely.
And should each of your toes be able to bend back like the same?
Yeah.
All of them?
Well, no.
Just your big toe. Because like I know my one doesn't bend and the other one does.
No, just your big toes should be able to.
But they should like bend back the same distance on each of them.
Yeah. I mean, unless you've had like a bunionectomy or
Yeah.
a fusion or something.
Yeah.
But you have an issue with
Yeah.
your big toe.
Yeah.
Oh,
Well, it's on my bad foot that has all sorts of stuff. But I've always told the doctors, I'm like, it doesn't bend as much. Oh, it bends enough. I'm like, not compared to the
We'll
other
come
one.
over, we'll throw some tools at you and get it going. All right, and then they actually Jack Daniels looked at low flexibility areas. So he had high flexible areas that want to be mobile, and they looked at low flexibility. And within specific to running, he said hamstring, the ideal is 60 to 80 degrees of a straight leg raise. So that's, if you're laying on your back, let's go right here. So you lay down, and then the leg comes up like that, keeping it down. I'm a little tight, but you don't want to be the gymnast girl that kisses her kneecap and has too much range of motion, because they've looked at, in that study there, Traherne in 09 says that excess lowered running economy. So they had too much range of motion within the hamstrings. So that makes, I think, all us men feel a little bit better. You know, our tight hamstrings that people laugh at are actually doing some good.
So how do you get hurt because of that?
How do you get hurt?
Oh, you pull your hamstring.
Just because you overstride?
I think so. Yeah. Yep. You're probably, a lot of it was saying, yeah, as you come through, because there's not passive tension within the muscle to help decelerate the leg, you're getting an increased stride. Yeah. Because there's, you know, passive tension is a big part of it too. The muscles, just the length of the muscle itself, not being contracted or active, has an effect on the joint position. So it's just not allowing that deceleration like it needs to. So does that mean that everybody that's highly flexible is going to have a problem? No, but it could be a factor. And so then the modification might be being more aware of your stride length, trying to shorten your steps, you know, rather than just going after it and allowing that to kick forward. And they said if you have more than 90 degrees of a straight leg raise, it could increase your recovery time if you're injured. So, all right. So I took the top three. So patellofemoral pain, IT band syndrome, and then plantar fasciitis, and just went through a couple things that I've seen, and Joe Nuttall, the guy that I went to, some of his recommendations. So for patellofemoral pain, flexibility in the quads, that's a big part of it. You know, the heel to butt test, also the hip flexor, allowing that leg to come up. He talked about getting rid of other plyometrics outside of therapy or outside of running. He put CrossFit on there, and that can be a big part of it. If you're having knee pain and you're doing box jumps, you know, even if it's just once a week or something, obviously that's not going to be good for us. So you got to look at everything that you're doing, you know, all your activities, and try and figure out, okay, what do I cut out? So plyometrics are probably one of those things. If you're having knee pain, you want to get rid of that. Open chain quad lag. So a lot of these patients, they'll come into therapy, or you guys can test yourself. If you're having knee pain, what quad lag means, if you're trying to straighten your leg like that, you can't do it. It's hard for you to do that. So your quad is tightening to straighten your leg, getting that last bit of extension, and you're not able to do that because of the injury. So you want to treat that directly. Try and get that quad. It's not that it's weak, because of swelling and inflammation, it gets inhibited. So that's a big part of your recovery, is getting that back. Hip stability training, and this is probably the biggest thing I came away from that course, is how important, and before I thought that, but hip stability in running is huge. You know, particularly hip abduction, being able to take your leg out. And obviously when you run, you don't do this. So when you run, every time you land, if you don't have good control in this muscle, there's going to be some deviation at your knee or your foot because of weakness here. Because when your foot is fixed, there's nothing that can move at the hip. All the problems can be transferred here into the knee or the foot, when actually the real problem's here. Now the symptom can be here, but the problem's here. So hip stability and training is huge. Cross training, obviously you're going to have to cut things down as well as maintain your cardiovascular. So cross training comes into play big time with any injury. He recommended cutting your mileage by 50% if you're having knee pain. And so that's where cross training comes into play. And I'll talk into another thing called aqua jogging, where you can equivalate what your running might be for that day through other exercise, through running in the pool or other things. So it's funny when you try and talk to a runner about, okay, you probably need to stop running for a little bit. It's like you ask them to cut their arm off sometime, which is fine. You know, you got to be passionate about your sport, but I think you also got to be okay with, all right, I can't run for a while. I'm going to do this instead. You know, you find something else to maintain your fitness and help your body heal. Uphill training was something that they found. You know, and I think everyone can attest, if you run anything downhill, you're 10 times as sore after that compared to something uphill. So a lot of the training that you'll do with knee pain will just be doing incline training, something uphill. No back-to-back days, give your body time to recover. So as far as an exercise progression that we do with somebody that has knee pain, we do what's called a toe pull. So you get a towel. So if I'm sitting on the table, sorry, stand up in the back, you can't see. You would get a towel, put it around your foot here, and then help that knee come down. And at the same time, you're trying to contract your quad. So you're pulling it back. So you pretend that's a towel, and you're pulling that knee into full extension, and at the same time, you're tightening your quad. That's to help that lag that I was talking about. So you're manually maybe having to push it at first because your muscle won't do it, and then you just keep working it until you can. Thank you. So towel would be better. Longer towel too.
Oh, sorry.
Beggars can't be choosers. So then you're pulling here, tightening the quad, and pushing that knee down at the same time. Okay? That's a pretty good exercise. And if you guys have knee pain, if you've had a surgery or something, you can attest to that. Whenever you have swelling and inflammation around your knee, you try and just tighten that muscle and it's different. You'll do it to your other side, then you do it to this side, and it's like, what's the problem? So re-educating that nerve and muscle to fire together is a big part of it. Okay, mini squats with a band. So this is the band, and we'll get people, you slide it up their legs, get it right around their knees, and then you just do a mini squat. Okay, and this addresses hip weakness. So something I always look at, if I say somebody, okay, do a squat, and they come down like this, can you guys see that? I mean, that's over exaggerated. But if somebody's doing this on a simple squat, what are they doing every time that they run? You know, they plant their foot. I mean, if you did super slow-mo, you'd probably see that translation that comes in, and that's a big part of patellofemoral pain. And that comes from the hip. That's nothing wrong with the knee. That's hip weakness. And the mini band around here as you squat down, that's going to activate your hips as you're squatting. Okay? Mini band side to side, so that's just putting the band around you, and then you're just walking like this, so you're keeping tension on the band, staying crouched. That fires up your hips pretty quick. Okay? Oh, I skipped one. Bohemian lunge. This is my new favorite exercise. It's awesome for your glutes. Okay? So the way, is there an empty chair? Let me borrow that one. So you start with a chair on the Bohemian lunge, and then you'll progress to something maybe less stable, like a ball. But what you do, I don't want to move that. So you have, let's say if I'm trying to work my right glute, that's where my problem is. You get your foot out here like this, and then you're gonna drop down so your chest comes to your knee, and then come back up. So a lot of times people will do it, and they go like this first, and then come forward. When you do it like this, I feel way more burn in my quad, and that's not what we're trying to target. We're trying to get the glute. So you fall forward, chest to knee, just like that, and I feel that in my glute, and then come up. Just right there, just like that. And the goal is that you hardly need something to support your back foot. You have all that support just on the front leg. So you're coming just like this. You know, again, watching where your foot is. You don't want to have your knee coming over the top of your toe. You just drop straight down like that and then come up. You do a few of those and your butt's burning, that's for sure. So, any questions on that?
So if you're pro on that, you can just like lift your back leg in the air and do it?
I don't know if you can do that,
Okay.
but you can do it on a ball.
Yeah.
And I've tried it on the ball. It didn't go good. So I'm not there yet. But I think it just gives you so much stability within your hip that you're able to control that movement.
Yeah, that's cool.
It's an awesome exercise. So another part to treating the knee is side planks. You guys know what side plank is? Yeah. So you're down right here like this. I should have got someone to come volunteer to do this. Here, and then you progress to doing clamshell, and then you progress to putting a band around your knees, and then doing the clamshell. So you're probably thinking, I have knee pain. What the heck am I doing like Pilates workout for? But they found through a lot of the research that your hips, your core, all those things are a huge part of your stability at your knee and your lower foot when you're running. So that's kind of the progression. And then obviously other core stability and training. So, okay. So IT band. Shoes are a big part of this. I think just because of that motion, kind of like we were talking about earlier on a training surface, if you're on an angle, it's going to create undue stress in certain areas. I think the IT band is probably the one that suffers the most in those situations. So they talked about using maybe a lateral wedge in your shoe if you have some IT band symptoms. And it's not a huge wedge, but getting you out of that coming all the way down. Okay, so that's an option if you are having that problem. Stretches, I think we kind of talked about this. It's very hard to stretch the IT band, but there is a few. So one of them is you put this leg, let's see, how's the best way to do it? So you come here, and so if I'm stretching this side, my left one, I'm going to cross it and then lean away. So you're trying to lengthen all that tissue. And if it's really sore, you're going to feel that. You know, in an average person, it's probably, you're going to think I'm not doing anything. But you can stretch it, but like I said before, I think the best treatment for the IT band is not necessarily to lengthen it, but improve the function of it through foam rolling and grass and race. And then hip abductor strength, closed chain strengthening, that's exactly what I was talking about with the band. You know, you're here and you're trying to stabilize the hip, which then in turn stabilizes the knee. Because it's almost like you have a rope here hooked to this long bone, and then if it's not strong here, it can't hold it up. So when you plant here, you're getting that movement. So if it's strong, it's able to stabilize no matter what happens. So that's a big part of that. And that's kind of what I was going here. Open kinetic chain. So that's like if I'm standing here doing this, that's hip abduction, and I'm strong in that. It's like, well, my hip abductors are way strong. Why am I having problems in running? You know, it's way different. Just like when you go to closed chain, that's a completely different animal. If you're weak there, that's going to create problems with the knee. Okay. Hip flexor, quad stretching, kind of the same stuff as with patellofemoral pain. Graston and foam roll. Has everyone had an opportunity to foam roll their IT band? Feels good, right? So, you guys have one in here, don't you?
Yeah.
Okay. So I think with the IT band, you want to kind of progress yourself. You know, if you just lay down straight to the ground and start rolling on it, you're going to be dying. Even if you don't have problems, it's going to create some pain for you. So I suggest the first place to start is like on a wall. So if you're just on the wall, you just position it here, and then you roll like this, okay? Then you roll down lower, roll like that. And then you progress yourself to the ground to where you're here, but you're controlling your body weight with my arm here and my other leg. Then when you want to get real crazy, you just roll it and prepare to cry. All for running, right? We love it. So that's a pretty good progression there, just going from the wall and then supporting your body weight and then go full bore when you're ready. And a big thing they said, do not run through pain with the IT band. If you're having that pain there, do something about it, address it. You know, and that's a hard thing to do, especially if you're like, man, I got the marathon in the month, I got long run Saturday, yada, yada, yada. You know, you'll be better off in the long term. Address that pain, get it taken care of. Most of the time it happens in a slower run. So if you're running faster, it doesn't bug you. So you can do maybe some interval training with some quick speed work and not aggravate the condition. It's those slow, long runs that you're probably going to want to avoid if you're having that flare up. Same as patellofemoral pain. Start with some incline training, just because the stress is easier physiologically on the IT band. Avoid foot whip. You've probably seen some people that do that. They'll come through and run, and it goes like that. You know, you can see everything, that's way over exaggerated, but you can see what that's going to do to the IT band as you come through there and then whip it back straight. So those are some modifications, like we were talking about with you, that should be addressed. You know, and I know here, you guys do a lot of the, like, can someone come in and just get a gait analysis running? Yeah. I know we've done it with a few of our patients, and it's way helpful to see what you're doing. It's one thing for somebody to say, hey, you're doing this, this, and this, and then you see it, and it's like, oh yeah, you know, they weren't kidding. So I think that's a big part of it. And then this is Joel talking here. Stand tall, butt tucked is what he says. So when you're running, you tuck that butt under you. It's like a posterior tilt. Helps with decreasing the knee pain. That's what he said. So stand tall, butt tucked. Don't forget that. All right, so an exercise progression, a lot of the same stuff. Step ups, if it's really bad, you progress to that Bohemian lunge that I showed you. Dose of that lunge, I would probably start out with maybe 10 of them twice a day. See how you feel. Yeah.
These prevention exercises as well as treatment.
Oh yeah, for sure. Definitely. Yeah, if you're not having any pain, start doing these. You know, they're awesome. Yeah.
What are the step ups?
That's just a step up onto maybe a stair or, you know, stuff like this. You know, those are step up platforms, you know. That's going to help your glute. It's kind of the same motion. You're coming up here and pulling yourself through, just like as you come down into that Bohemian and then coming up. It's kind of the same motion, just the beginning phase of that. If you can't do the Bohemian, start with the step up. Then mini band side to side, you know, and you can do those in two different positions. You can go above the knees or below the knees. I like above the knees, but you can vary it. And just the key to it is it's on there and you're staying in this position, because every time that you pull out here and then bring yourself back, your hip just gets on fire. You know, those are good warm-up exercises too. Get some bands before you run. Work yourself in a circle. Work back the other way. You know, it just opens things up, gets you ready to go. Side planks with the clam. Progress to the tubing. That's the one that I demonstrated earlier. So you're on your side, opening up those hips again. Mini band squats, eccentric side planks. So that's where you come up into the plank. So you're up here, and then you slowly lower yourself down. So eccentric is controlled contraction. Just like a negative in weight training, you know, you're allowing that muscle to stretch and contract at the same time. Okay? Core stability and hamstring strengthening, those are all big parts of it. You know, I think P90X has a lot of good things on it too, especially core. So you can't really hurt. I mean, anything that hurts or aggravates, you probably want to avoid. But if there's a lot of good things out there for your core, you know, they're going to help your running for sure. Gives you a lot better control of your body. It's like your foundation. And then they recommended plyometrics for IT bend. So like jump lunges, those are not fun, but they're good. Squat jumps, lateral jumps, so you're coming here to here, okay? And then triple hops, that's like in a pattern this way. So you're here like 1, 2, 3, jumping one-legged. Those type of things, 1 time a week if you're having IT band pain. Helps improve your recovery time. All right, so plantar fasciitis real quick. Get out of the uncushioned shoe. You know, obviously, like barefoot running, that's going to put tons of stress to your plantar fascia. And then some of that goes back to that great toe extension. If you're not having that as you're toeing off, all that tension is going to go through your plantar fascia. Everyone know where your plantar fascia is? Right on the bottom of your foot. You know, as you bring your toes up, you'll feel that kind of band that stretches from your heel to your toes. That's your plantar fascia. Most commonly hurts first thing in the morning if you have it. You step down, that first step's awful. If you're experiencing that, then you know you probably have some plantar fascia. Pronated foot type. So what pronation means is as that foot comes down this way, your arch collapses. So, you know, you'll hear pronation, supination, you know, are you neutral, you're pronator, you know, that's what they're referring to as that position of your arch. So as you come down and step, you overly pronate, you flatten that arch out. That creates stress to the plantar fascia. So you want to address that through the proper footwear or inserts if needed. So he recommended a non-rigid cushioned heel is the best thing that he's found for plantar fascia. And then Graston actually is pretty effective for plantar fascia. It doesn't feel very good, but so if you're not having a response or it's not getting better in 3 weeks, then come see somebody and we can do some Graston. So we do free screens here. So if you're having issues and you're not sure what it is and what's going on, just call our office and we'll at least take a look at you, 15, 20 minutes, and then say, you know what the best thing to do is. So you don't have to sign up for a full-blown therapy treatment. Come in and just get screened. Calf and ankle flexibility, a lot of the stuff like knees to wall, know where you're at. That can have an impact on plantar fascia. Night splints are way effective, I think. If you're having plantar fascia pain, especially if you're having that pain first thing in the morning, you can get a night splint. So it's a splint that you wear through the night that helps bring your foot up and stretch that plantar fascia. So if you're having that first step in the morning, do that. And then obviously the big toe stretch. Parallel to shin is what you want. Okay? So with plantar fascia, you pretty much have to stop running to calm those symptoms down. They can flare up pretty bad. So the last thing you want to do is push through it. Get it better first, and then get back to running. And in a second here, I'll get into alternatives to running. So if you can't run because of an injury, things you can do so you're not behind in your training. Avoid hard surfaces. Get out of the rigid heel strike. Try and be more soft in your landing. And if you are, you definitely want to cut mileage if you're not cutting it all together. Okay? All right, so returning to run. Let's say you get hurt, things to do to get back. Start gradual every other day. When I trained for a marathon, I ran Tuesday, Thursday, and Saturday. And then I cross-trained on Wednesday. That's all I did. And I didn't break any records, but I finished and I didn't have any pain or problem. Adapt your pace to allow proper form. So obviously it's kind of like we were talking about the excessive length of the hamstring. You know, if you're having problems with that, change your cadence, change your stride length. Do those things to adjust to your injury. And then, like we've talked about before, 10 to 50% mileage progression is the most accepted. So it's not 0 to 60. It's doing it in increments. All right, so a couple alternatives to running, just to keep your cardiovascular up. Obviously elliptical, stair-stepper, bike, incline training. And what they put together is an equivalent. So if you're doing the elliptical, let's say you can't run because you're hurt, but you can do the elliptical pain-free. So if you're scheduled to do a 6-mile run, and you run, let's say at an 8-minute mile pace, that's 48 minutes of running. So the equivalent is 48 times 1.3. So to get the same out of that, you're going to need to be on the elliptical for 63 minutes. That's a long time. That wouldn't be very fun unless you had a movie on or something. But it's an option, you know, so you're not just sitting at home with your foot up saying, crap, you know, what am I going to do when I can run again? you know, and then your cardiovascular system is diminished. Stair steppers, pretty much the same. Bike is 3 to 1. There's a whole form on that. It's kind of cool. All right, and then aqua jogging. This is something that I mean, when I think aqua jogging, I think you go get in water about this deep and you just run back and forth in the pool. But aqua jogging is you get in deep water, get a flotation belt, and then you actually run or jog. You do the same motion. Your feet are not contacting the floor. This is a great way to maintain your fitness. They've shown through studies that it improves your form. So if you're having pain or you have problems, you can get into a pool and get your mileage in. So it's 1.25 equivalent. So if you're running, same scenario, 6-mile run, 8-minute pace, that's 48 minutes of land run, equivalates to 60 minutes of aqua jogging. And there's a study that Joel talked about. They took people, I think it was for 2 months, and had one group run just in the pool, all their mileage, one group on land, and their outcomes were exactly the same. I mean, obviously you're going to have some, they talked about the impact training when you're on land is different. You're going to have some strength things, so they recommend adding like a calf strengthening program to aqua jogging, but it's a good option. If you're hurting and can't run on land, get in a pool, and then you can keep up your pace. So, okay, that's it. Questions that we haven't already talked about? Okay, right on. Well, thanks for letting me be here. If you guys are tired of getting hurt and running, call me. We'll go out and ride a bike. This is fun. So, I'm just partial to mountain biking right now, that's all. So, anyway, thanks for coming.
Awesome.
Is everybody doing, how many people are doing the marathon?